Meningitis by Chelsea Roberge and Brittany Rath. A 45-year-old male named Jim comes into emergency with his wife. He is presenting the following symptoms: frequent stiff neck, recurring headaches, and difficulty concentrating when working and at home. His wife states that he seems confused and not sure of what's going on sometimes. The doctor orders some testing, starting with blood work and sending the patient for an X-ray and CT scan. The doctor returns with the blood test, X-ray, and CT scan results and has witnessed an elevated white blood cell count, some swelling, and what looks to be an infection that may be associated with meningitis. To confirm if it is meningitis, the doctor does a spinal tap. The structure of meninges. The dura mater, or outermost superficial layer, is the layer that connects the meninges to the skull and vertebral column. It also covers the nerves of the brain within the skull. The dura mater is made of a tough fibrous connective tissue. The dura mater surrounding the brain consists of two layers. The first layer is the periosteal layer, which is the outer layer that connects the dura mater to the skull and covers the meningeal layer. The second layer is the meningeal layer. This layer forms dural folds that split the brain cavity into different compartments. These compartments support and accommodate various sections of the brain. In between these two layers are channels called the dural venous sinuses. The dural venous sinuses receive blood from the cerebral veins, and they also receive cerebrospinal fluid from the subarachnoid space. Their purpose is to collect venous blood and deliver it to the internal jugular veins at the base of the skull. The arachnoid matter is a middle layer composed of elastic connective tissue. It resembles the appearance and consistency of a cobweb. The arachnoid matter is a layer of the meninges that loosely surrounds the brain and spinal cord and connects the dura mater to the pia mater. Web-like fibrous trabeculae connect the arachnoid and pia mater. The space between these two layers is known as the subarachnoid space. The subarachnoid space provides a passageway for blood vessels and nerves to the brain and also collects cerebrospinal fluid. Projections from the arachnoid matter, known as arachnoid granulations, form a connection between the subarachnoid space and the dura mater. These granulations take cerebrospinal fluid from the subarachnoid space and send it to the dural venous sinuses of the dura mater. The pia mater is the thinnest, deepest layer of the meninges that is in direct contact with the brain and spinal cord. The pia mater contains a rich supply of blood vessels, which provide nutrients to the nervous tissues. The pia mater contains a plexus of cells known as a choroid plexus. This plexus produces cerebrospinal fluid. The pia mater covering the spinal cord has two layers: outer layer, which consists of collagen fibers, and the inner layer. This layer surrounds the entire spinal cord. This layer is thicker and less vascular than the pia mater that covers the brain. So, what do healthy meninges do? Meninges is a Latin word for membrane. Overall, the meninges provide structural support for the brain. They contain cerebrospinal fluid, which surrounds the brain and spinal cord and acts as a cushion for the brain and spinal cord, protecting them from injury. The meninges also serve as a transport system for the brain, bringing in nutrients and removing wastes. Specific functions to the layers include: dura mater, or tough mother, serves as an extra protective layer. It attaches the brain to the skull and spinal cord to the vertebral column. The dura mater provides a system in which blood can leave the brain. Arachnoid matter. The arachnoid trabeculae helps suspend the brain in place. It stretches between the arachnoid and pia mater. The subarachnoid space between pia mater and arachnoid matter contains cerebrospinal fluid. Pia mater, or gentle mother, acts as a barrier surrounding the brain and spinal cord. Pia mater houses and secretes cerebrospinal fluid. How meningitis affects the human brain. Meningitis is an inflammation of the fluid and membranes, also known as the meninges, that surround the brain and spinal cord. Meningitis can affect babies, toddlers, and adults. So, as a virus or bacteria travels through the bloodstream and makes its way to the brain and spinal cord, an inflammation develops on these three protective membranes. The inflammation causes pressure and swelling on the brain, which then triggers the signs and symptoms of meningitis. If untreated, the inflammation will cause damage to the brain and spinal cord.
Signs and symptoms of meningitis. Some of the most common symptoms are headache, fever, stiff neck, confusion, and trouble concentrating. The more severe symptoms are rashes, seizures, drowsiness, sensitivity to light, vomiting, and purple areas of the skin that resemble bruises. Some symptoms for babies or toddlers are irritable, decreased appetite, lethargic, and fevers. Diagnosis. Your doctor can diagnose meningitis based on a medical history, a physical exam, and certain diagnostic tests. During the exam, your doctor may check for signs of infection around the head, ears, throat, and skin along the spine. First is a blood test and blood cultures. A simple blood sample is taken to see if there has been an increase in the white blood cell counts, and blood cultures help determine what bacteria your body may be potentially fighting off. Imaging. MRI scans of the head may show swelling or inflammation. X-rays or CT scans of the chest or sinuses also may show infection that may be associated with meningitis. Spinal tap. For a definitive diagnosis of meningitis, patients will need a spinal tap to collect cerebrospinal fluid. In people with meningitis, the CSF shows a low sugar level along with an increased white blood cell count and increased proteins. Viral meningitis. Viral meningitis is the most common type of meningitis to be diagnosed. It usually presents itself as a viral infection such as fever, general feeling of illness, and headaches. It is easily contagious and can be spread through bodily fluids, sneezing, and coughing. One of the most common causes of viral meningitis is enteroviruses. Enteroviruses are a group of viruses that can cause a number of infectious diseases, which are usually mild. Other forms of viruses that can cause meningitis are mumps, measles, herpes, and other viruses that are spread through blood-feeding insects. Once a virus has entered the body and into the bloodstream, it travels to the brain and crosses over into the cerebral spinal fluid and affects the cells of the meninges, which in turn causes the inflammation on the 3 layers of the meninges. Other types of meningitis. Bacterial. Bacterial meningitis can be very serious and can sometimes lead to death. Most people recover from this strain, but if left untreated may lead to permanent disabilities, the biggest being brain damage or death. There are several types of bacteria that can cause meningitis. One of the most known ones are Streptococcus. Bacterial meningitis is when bacteria enters the bloodstream and travels to the brain and spinal cord, causing acute bacterial meningitis. Depending on the type of bacteria you may carry, it can spread through sneezing, coughing, sharing saliva, eating contaminated food, or mothers passing it on to their babies when born. Fungal. Fungal meningitis is rare and is not spread from person to person. It is usually inhaled and then spreads by the blood to the CNS, which causes effects on the brain. People who are immunocompromised are advised to stay away from these areas where soil, dust, or bird droppings may have a high fungal contamination. Chronic. Chronic meningitis is defined as inflammatory cerebrospinal fluid that can persist for at least 1 month. Chronic meningitis can be divided into 3 categories: infectious, inflammatory, and neoplastic, also known as a brain tumor. To be diagnosed with chronic meningitis, it first requires a detailed patient history, including travel history, potential exposures, medications, and many more. From the history, the doctor will be able to pinpoint what category of chronic meningitis is being shown and will be able to build a treatment plan. There are many different strains of meningitis, but these are the most common types of meningitis in Canada and the States. Treatments for meningitis. Viral meningitis usually clears up on its own. You can help treat this type by getting lots of rest, fluid, or seeing your doctor for a prescription for pain or swelling. Bacterial usually requires a prescription of antibiotics, whether that's intravenous or oral, and a prescription for steroids for the swelling, and get lots of rest and fluids. Usually requires a hospital stay. Fungal requires a prescription for antifungal medication. Chronic. The treatment for this type of meningitis is determined by the underlying cause, where the doctor will need further testing to determine what that is and prescribe the correct antibiotics. Another form of treatment is vaccines. There are specific vaccines for the prevention of meningitis that you can get as a kid or as a teenager. In summary, after 24 hours, Jim's results from the spinal tap shows low sugar levels, elevated white blood cell count, and increased proteins. From these results, the doctor is able to diagnose the patient with viral meningitis. The doctor prescribes Jim with a course of corticoid steroids to reduce the swelling in the brain and tells him to get lots of rest and increase fluid intake.